mentioned I'm 70, and let's say because of your company 5 years from now, what's going to change in my world or somebody like me? What's going to be the one thing because of what you're doing that wouldn't have been true back in 2024 if we're talking about 2029?
Our technology is really going to change the way we approach health, and similar to what Scott was mentioning, and longitudinal monitoring, but on a blood basis. And so what we perform is a multi-omic analysis that digs deep and provides insights into um, conditions that are arising before they become symptomatic. Recently, we identified a pancreatic cancer patient at the earliest possible stages in stage one. We can do this with Alzheimer's disease. In fact, we do it across 26 major conditions. And so I think in your case, Steve, what we'll do is we'll test you at least once a year. If we see something, we'll test you, maybe every 6 months to refine it a bit and make sure that that disease that might be emerging doesn't emerge. We make those changes in your lifestyle so that you avoid that and avoid taking any medications. If you are on medications, we can support you there. We can help you make sure that comorbidities don't arise, working with your practitioner, make it easy and simple for them to understand as well. So I think the future is bright as long as we move to a more proactive rather than a reactive, expensive healthcare.
So my three-part question is, what are you doing within your very innovative spaces to put trust in, and trust being as important as technology? Who's going to pay for what you're doing, and where do those benefits accrue, and how can you make sure that the new technologies aren't just helping Steve Klasko in Miami, but helping Mrs. Jones in North Philadelphia that might not have access to an Oura Ring and Apple Watch and the technologies that you're doing?
And this is a question that all 3 points are really something we think about deeply. The biggest thing that we've been able to do is concentrate our 280 metabolites and proteins into a platform that makes it super affordable to run. If you were to do that in any other platform, you would be spending thousands of dollars to get the kind of insights we were able to provide. And as we get more scale, this is going to be becoming more and more affordable. The interesting part about the biomarkers that we're analyzing is that a number of them are already reimbursable. And so we have CPT codes that we can apply and already get reimbursement for this. But we do expect that not all of this will be covered. So there will be some demonstration that this has a return on an investment from payers over time. The equity is something that is just so dear to everything we do. When we think about personalized health, how can you get more personal than an N of one? We do analysis on each individual as an N of one, compare that to all the world's literature through AI tools, and really understand where that individual is in their health journey and give them very precise, specific action plans that apply to them. This is empowering. So every individual is now not only knowing what they need to do, but they can follow this themselves in their day-to-day exercise. They're not relying on anybody else. That information is in their hands. It can be improved, of course, with interaction with the practitioners, but they become a part of their health journey, less reliant on the system. We've also partnered with the Buffalo Center for Health Equity to move this solution forward, because as we all understand, people on Medicaid tend to wait the last moment and end up in urgent or emergency care units that are prohibitively expensive and really not delivering any sort of affordable care whatsoever. And in fact, the cost of treating these individuals is much higher than it should be. The other thing that I'll add around the trust is that the beauty of the technology is that you see it happening. You get to follow as you change your action plan or any intervention, whether it's working or it's not. You can see if it's not working, you can make adjustments. And so you start to trust the physical aspects of your health beyond just what is being shared with you through how you're feeling, et cetera. The other thing that I'll share is that we continue to do expanding on studies with practitioners. We recently worked on some cancer therapies where we're able to demonstrate that immunoreactive adverse events associated with checkpoint inhibitors could be predicted in the individuals that went on to develop them and others that didn't. And we can actually see how the cancer therapies were being beneficial to those patients. And so this idea of demonstrating that the intervention is working has huge value, especially as we move more and more into value-based care method. And then the other thing I'll add is that by looking at each individual's, we can roll that data up and understand where a population is and give that visibility to payers so they understand where those big expenses in their healthcare dollars are going to come so that they can apply resources accurately rather than guessing on claims data. They can see exactly where their populations are trending, whether it be in a employer base or Medicare base. And then the last thing I'll add is that we're also doing a lot of work in Alzheimer's disease, and we've partnered with a group out of Florida where we've starting to work more in this guide program. So how do we provide that evidence-based support in the guide program that allows the patients to see, what is the best care path for them? We've been able to endotype and stratify Alzheimer's disease into 3 different categories so that we can really carefully design the care path that's going to be appropriate for them. And then by sharing this with Medicare as we go forward, we'll be able to demonstrate a return on the investment, and this will be supported going forward. So our goal is to make this as affordable and accessible to all people. And we all know that predictive care or preventive care is going to be a lot more affordable than reactive care.
It's hit me coming over from the traditional healthcare ecosystem to General Catalyst that the humans that are involved in your team are incredibly important. And all of you have curated, because it's all your money, who you have on your team. So in 3 to 5 words, if you could just say, what defines the culture of your team that really makes it unique, that will get somebody to want to invest in you?
Purpose-driven, radical collaboration, and value-based.